Hi, I'm Neil Chericho, Director of NTC Architects. I'm here with Nick Bournes, Director of NH Architecture. Firstly, we'd like to start by acknowledging the Wurundjeri Wurrung people as the traditional owners of the country where this project is located. This project, it delivers gold standard mental health outcomes for consumers in response to the recommendations of the Royal Commission to Victoria's mental health system. This project is one of 4 projects delivered under the $492 million mental health beds expansion program for our client Victorian Health Building Authority. We delivered 120 new acute mental health beds at Sunshine, Northern, Royal Melbourne Hospitals and McKellar Centre in Geelong. These images are existing mental health facilities that the Royal Commission partly wanted addressed. Lifeless courtyards, high containment fences, internalised dark spaces, limited views to the outside and looks and feels institutional. Our key architectural solutions are co-design process, which integrates people with lived experience, a hallucinogenic and biophilic design approach, access to daylight, spatial legibility and familiar and domestic, and a more granular design strands, the design for gender safety, designing for wellness provides consumer autonomy, high amenity landscapes and design for robustness. The building is designed as a 52-bed unit over 2 levels and is made from 330 steel modules. We created a new acute front door for the hospital, which is for a mental health precinct, deliberately separate from the hospital's front door. The traditional mental health layout is the panopticon, similar to prisons where consumers have very little privacy and accessible courtyards are external to the building, which requires then tall containment fences. Our new model internalises those courtyards and creates a building as the boundary and mitigates all those needs for tall containment fences. It also maximises the daylight into occupiable spaces and provides immediate access to the landscape and for spatial legibility. Our collaborative and integrated co-design process with people with lived experience ensure that the project delivers evidence-based designs and recovery-focused and promotes wellbeing for all occupants. The bedroom and en-suites are critical parts of the building, so these are the places where consumers are left unattended and unobserved and where most of the self-harm can occur. We built a full-scale modular prototype which was inspected and rigorously tested. To minimise all the ligature opportunities, there could not be a gap or a hole greater than 2 millimetres within the internal fabric. The internal environment minimises risks to both consumers and staff and reduces opportunities for adverse events to happen. Detailed analysis was undertaken on the layout of the bedrooms and corridors to ensure there were no hidey holes for consumers to hide and to mitigate ambush situations on staff and fellow consumers. Next slide as well. On both levels, the bedrooms are predominantly positioned to the north with views to nature, and each pod is clustered around one of 4 stepped courtyards. The Royal Commission recommended smaller cohorting and moving away from the traditional large cohorting. We created a share house type environment with a backyard, dedicated living and dining spaces. As mentioned, spatial legibility was important to help consumers understand where they are within the building, helps reduce anxiety. Courtyards and artwork are 2 devices that support this. There are 27 custom integrated pieces of artwork which help consumers understand where they are.
So, hallucinogenic is a term that means the building's active role in healthcare. It helps to be better. And biophilic, as we understand, is bringing nature into the project. Those 2 principles are paramount to how to deal with these projects, even though obviously we have all the parameters of healthcare and safety and 2 mil gaps and no ledges and nothing. We still tried very hard to make sure the place felt incredibly light-filled, familiar, and had nature at every turn. We in fact had opportunity for 27 artworks to happen throughout the project, which we helped select, which meant that in fact that spatial legibility is in fact enhanced through the idea that only one image appears in one place, so you always know where you are. Each space was obviously very important. There was both light-filled and views out, rather than the high wall, but even down to the lighting you see above your head is custom built for this project and it features circadian rhythms, so it changes lighting along with the day to again enhance the idea of understanding the world in which you live in rather than being institutionalised. On expanding on the idea of light is the access to natural light. Most panopticon plans never had direct view to the outside. You went through a doorway to an external courtyard. In this case, we organised these effectively 6-person share houses around a courtyard. You can see through, across and access at any time with natural light into all living spaces, of which they have a primary and a secondary living space. That then enables us to have limited amount of segregation between spaces, and when we do, we try to use things like glazing and other elements rather than the institutional style walling. One of the things that we also were very important to us that obviously being an acute healthcare environment, we are restricted to the sort of materials you think of in healthcare, and yet what we worked really hard with suppliers was to think about calming colours and colours that were familiar, fabrics that might feel familiar to a home, rather than, you know, the institutional primary school colour set you see within hospital spaces quite often. And then deployed those judiciously to give subtle readings of intimacy and openness. So we created lounges and things through using the materiality to create intimate and lower spaces, and then the circulation where the courtyard becomes the main space. Thank you. So the courtyard really becomes an extended part of that. As I said, the artworks are actually all local artists that were commissioned to come and hand paint artworks almost as a message of hope back into the people who occupy these spaces and become the fourth wall of all the spaces. I've lost my track. So really the last point to make is that this is a hospital environment, so it cannot be a home, but it can be familiar and it can be domestic in nature rather than institutional, by picking colours and tones that you'd actually see within your own home, but also materials that create better acoustic outcomes, allow the environment in, and allow light to bounce around and become a really positive space. Those contemporary palettes continue to push through to how we deal with things like living spaces, using a darker colour to create a smaller, warmer space, or working really, really hard with the very limited mental health furniture industry that's out there to get better fabrics on the chairs and things that can actually start to talk about something you might actually want in your house rather than something that's cobalt blue. And then down to even when you're thinking about the bedrooms and the consumer spaces, building in the idea of a bedhead, the idea of bringing the window around as a timber piece, so that idea of the outside world starts to become, and the biophilic materials become part of the environment you're sleeping within and the coloration of the space. The last piece of innovation was to bring staff out of the fishbowl and onto the floor through these collaboration hubs. The idea that you sit around a seat, you bring a laptop out, use technology, and you sit with people in their space, in a common space, to work and interact in a more intimate zone. Creating a whole series of spaces that people can actually have different elements of the day. They can have a day that feels different through different parts of the day. They can enjoy the long views and daylight. You can start to see that the courtyards are always pervasive and the long view is always pervasive, which again, if you know anything about acute healthcare, is incredibly rare in these deep plan buildings. To finish off, this is actually the ambulance bay. This is the first experience that most people have of arriving. That idea about wellness has been brought right to this spot. So it's not a place to go for the sick, it's a place to be well. And that's the thing we want to have happen the moment you arrive, through the lighting and the materiality and the artwork.